Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is on intimacy and aging, sponsored by Prince George's County Government and the Department of Family Services.
And so with that, without further ado, I will let Ms. Maria Khader and Mr. Mark Asch take it away.
Thank you, Pam, and it's an honor and a blessing to be here, and it is an honor and a blessing to be a co-presenter with this young woman. She is one of the most amazing people in this industry, as you'll hear as we go through the presentation. And I'm here to be a lucky participant. So Maria, go ahead and take it away. I appreciate you and the value. So first, let me just go through our objectives real quick on the next slide. And these are just some of the things we're going to touch on. We're going to define in our presentation tonight the difference between intimacy and sex. We're going to identify myths about sexuality, especially among the elderly. We're going to approach sexuality, talk about approaching sexuality and having that discussion with your loved ones. We're going to discuss behaviors and their meaning, specifically as it relates to the dementia population. We're going to talk about consent and understanding what consent means. And we're going to talk about the greater need overall for training and awareness, both in an institutional setting and equally as importantly, in the home setting. So Maria, go ahead to the next slide, Pam, and we'll let Maria kick it off.
Thank you so much for having me, Pam and Mark. It's an honor to be with you both, and it's an honor to talk about the intimacy, sexuality, and aging, and mostly in people with dementia and Alzheimer's disease. And as Mark said, we're going to be, after talking about the objective, we try to cover it and make it as simple as possible so we all understand it, not just the professionals who work with people with dementia and Alzheimer's. It's also for the caregivers who are taking care of their loved one at home, facing this kind of issues with them. So we're going to talk about what is the intimacy and what is the difference between intimacy versus sex. Like the intimacy is defined as the closeness between the people in personal relationship, and can be physical closeness, emotional closeness, spiritual. It is different from sex, where sex is the real sex, the real intercourse, whether intercourse or outercourse between the partners. And intimacy versus sex, it's an open communication. And if you see the scale there, you will tell that intimacy always get more weight than sex, because we want to give it more weight than sex. The next slide, please. So, myths towards sex among elderly community. Most people, they think that when you are aging and you have people that are old at home or in an institution, they will say, sex is not for old people, it's only for younger people. Older people don't have any sexual desire. Older people, it's so disgusting to see them having or to have sex. Older people are physically unattractive. Not only unattractive, they're unable to do it. And if older people is interested in sex, they're dirty, or their mind is dirty. The philosophy or the myth, older people are not ready to have sex because they're old, they're aged. So elderly people, the myth there talking about elderly people is not right when you say this about them. The next slide, please. So when we talk about the myth and aging, we have to connect these slides together. So when you say he's expressing sexual expressions, how are you related to that? Because it can be when an older person start expressing sex, it is important for them to express. Whether, by the way, we're talking about male and female. We're not talking about just the male, because females are ready to express sex, and the myth is also applied to them too. So it provides tension release, stress. It reduces the stress among them. It also gives them the feeling that they're not lonely. It also gives them a mutual pleasure. It is not only like for one person pleasure. So when a man comes to talk to a woman, or a woman comes to talk to a man, or a man to a man, or a woman to a woman, it gives them both a mutual pleasure. It enhances self-esteem in them and give them a good quality of life. Next, please. So what
I
is
love this. I love this, Maria. And intimacy is important in every aspect of our lives, and it's important, and especially as our elder loved ones, Maria, move into communities, whether their spouse has passed on, or whether they and their spouse are moving into a different community. Understanding intimacy, it helps you understand how to develop those new relationships, how to nurture yourself and others.
exactly?
It's understanding, combating the loneliness that we may feel, the depression, the cognitive decline. Intimacy is that human engagement, that human connection. It builds trust. It's so important in this day and age that we don't deprive anyone of those types of things.
And
Next slide.
exactly. And we don't want to keeping those elderly and keep things in the taboo. Things has to start being more open. Things has to start, let them express themselves. Don't hide them. Don't cause any emotional depression. Don't cause suicidal thoughts in their heads when you keep them away from expressing themselves. Next slide, please. Sexuality and sensuality may be expressed by how they express their sexual desire or intimacy desire is by engaging in the sexual intercourse. We jump to the sexual intercourse because most of them, they think that this is the way it is, but it can be just by touching. This is intercourse. It can be by touching, holding hands. It can be by masturbating, and this happen a lot. You will go, your husband at home, you can see him, let him do it. Your wife at home, you are the caregiver for her, she's doing it, let her do it. It's their way of expressing themselves. It's their way of releasing the tension. It's their way of reducing the stress that they are going through. They're so frustrated that they cannot express themselves because of the dementia, but they know that they have this desire to do. Let them do it. So these are expressions, are basic rights for all those people. We're calling it residence if it's in a facility, or your spouse if it's at home, or partner if you are caring for this partner at home. Next slide, please. So how to maintain intimacy without intercourse? This is important because you see this most of the time. If you are at home as a caregiver for your husband, for your spouse, or for your partner, it's the touch each other, sit next to him, hold her hand, hold his hand, let them cuddle, let them hug, let them kiss, let them express themselves by kissing your hand, by kissing your cheek, by even kissing your lips. Let them hug you. Most of the time you will see them, or you will hear them say, come and cuddle with me. Or they will say, why don't you just come just sit next to me, let me feel your warmth. They can say, just come sit next to me and talk to me. It helps. Let them do this kind of intimacy. This is how to maintain intimacy without intercourse. And it can be so pleasurable for them, equal to having intercourse.
I love this, Maria. One of the points you bring up is about holding hands. Holding hands when you first develop a relationship. And my wife and I have been together almost 18 years. And one of the first things you do when you start to become serious with someone is you walk along and you hold their hand. It's still a blessing to this day when I feel my wife's hand in mine, and there's something so powerful in that connection. And so I love that you bring that up, that's one of the ways that we can all express that intimacy without there being anything greater physical at the time. And if there is something physical, it should always be in the appropriate time, at the appropriate place. But holding hands is a great way to express intimacy and to feel that touch without there having to be great drama behind.
Exactly.
Thank you so much for that.
You're welcome. And cuddling, please, at any time your spouse, your partner ask you to cuddle with them. This is a very, very important thing for them. They're dementic. They need someone to make them feel secure, make them feel that they are still loved, make them feel that they're still wanted. They're not lonely. They are, as I said, they cannot express themselves. So this is the only way they can express themselves with, by holding the hand, touching your body, feeling your warmth, cuddling with you. Don't let them go without having it. They're asking for it. Sometimes they cannot talk and they cannot ask for it, but they come and sit next to you and you can feel that they're snuggling next to you. Keep going. Encourage them. That reduces their stress that they're going through. Next slide.
So here's the reality check, everyone. Sexuality is a total sensory experience involving the whole mind and body. Nature and nurture play a role in this. Next slide, please.
Guess what?
Sexuality, I love it. It's from the womb to the tomb. There's never a bad time.
And look at you. Exactly. Look at you. From the first time, the first minute you are born, it's in you, in me, in her, in him. You go through all your stages of life until the last breath. So don't ever think that sexuality doesn't belong to older people. It is there in them. It's something God put in us, and we are supposed to enjoy it. Let them enjoy it.
Thank you. Next slide, please, Pam.
All right. Now, these are important considerations. There are important considerations interfering with health and sexuality. And as we all know, in the health feed, you are at home and your husband has some medication or your spouse have medication. Sometimes they're not able to do any sexual intimacy with you, with her, because of medication side effects, because this has a stroke, has COPD, diabetes, arthritis, body image changes. They also, all of these important medical issues affect their healthy body. With the COPD, we all know that the shortness of breath, they're not able to do any effective physical activity. The stroke, they lose either part of their body movement or for part of their body, all part of their body, but their brain is still functioning, but they cannot do the sexuality and the intimacy together. So these are all affecting the healthy intimacy and healthy sexuality. Someone with catheter, whether a female or male, it interferes with the sexuality. Someone with a prostatectomy, it interferes with that. Someone with erectile dysfunction, someone has in his life or her life is being abused sexually. That will always be in her mind that, too many times, as I work in an assisted living, too many times we want to change and give them their personal hygiene at the facility. We start undressing them immediately because of their previous behavior or previous experience with sexual abuse. You will see them that they don't want you to touch them. They don't want you to come close to them. So that affects the sexuality between spouse and his wife or a partner at home, because that brings the bad experience that they went through. Later marriages, sometimes because of aging, again, it might be dysfunction affecting their sexuality and intimacy. Removal of the prostate, as we said, prostatectomy, and amputation of one limb or both. Removal of the uterus or breast, if the lady has a breast cancer and she has to remove the breast. If they have colostomy or ileostomy. Colostomy, some people, they don't know it. I just want to say that when they started using the, instead of the rectal and getting the bowel movement through the rectal area, it will be through an opening in the abdomen. So it will be like sometimes smelly, and that gives them very bad body image, and it also affect their intimacy and sexuality and the healthy sexuality. So these are important medical, I would say, conditions that affect or interfere with their healthy sexuality. The next slide, please. So what do we advise our spouse or advise our caregivers at home to have the sexual intimacy between the elderly, like a lady with her husband at home, with her spouse, or the other way, or even a partners together, females or males? We will try to tell them what to use to make it more enhanced and more effective and more pleasurable between the two of them. So we usually advise them why don't you use some lubricant? It will help you to use it. Or we can just advise with that the doctor, go to the doctor and he or she will give you hormonal replacement, or they will give you the pill. We all know about the blue pill, everyone go to the doctor and they will say it's the blue pill there, the Viagra. Sometimes they need some kind of medical treatment like oxygen for the people that they have COPD, that will give them more energy to do the sexuality or sexual activity. We encourage them, if they don't have any partner, we encourage them to do the masturbation, and we encourage them to either get those videos and magazines that let them give them the arousal. These are just simple things that you can advise the people at home, caregivers at home, or even in smaller facilities. We're not talking about facilities because that's a different protocol to work with. But now we're advising people more at home.
And I want to point out, if you are suggesting medication for your elderly loved one or your partner, whomever, that it always has to be sanctioned by the physician. Don't take, for gentlemen, don't take the blue pill because a friend is going to give it to you. Always get medication approved by your physician and ordered by your physician to ensure that it is the right medication for you based on your own health condition, because you don't want that to interfere with your intimacy and your sexuality moving forward. And the next slide, Pam, please. So some of the things that we talk about when we think about sexual health for older adults, and these things are occurring for a number of reasons. Sexually transmitted incidences and illnesses are increasing among older adults. Actually, it's the largest growing, most quickly growing population is among sexually transmitted diseases among older adults. HIV symptoms are often misdiagnosed in older adults. Some of these reasons is our seniors are moving into these independent living communities or continuing care communities, and our seniors maybe weren't educated about sexual protection or promiscuity or anything when they were younger, or even as they've gotten older. And they also believe that, well, I'm 75, I'm immune to any sexually transmitted diseases and all these sort of things. These are all falsehoods, okay? You must protect yourself at all times. So don't be embarrassed to ask for a test. Don't be embarrassed to ask your physician about HIV. Don't be embarrassed to go to the pharmacy and find the proper protection for you or for your elderly loved one. Preventative measures are so important as we get older, but they're decreasing among seniors, among our elderly. Condom usage decreasing, testing decreasing. It's important that we make sure we're maintaining a safe environment for ourselves or our loved ones to practice intimacy and sexuality. And also, we need to make sure that they're educated properly. The education is important. Let's not say, okay, mom's 75, she doesn't need protection, she doesn't. people are 50 years with the same partner, then they're, God forbid, their partner passes, they move into another community, they still, as we saw earlier, sexuality is from the womb to the tomb. So we want them to express their sexuality, their intimacy, as long as it's the right time and place, and as long as they properly prevent and protect themselves. Next slide, please, Pam. Thank you.
A change in the attitude and perspective. This is more important to the caregivers, the first or the frontline caregivers. See, I changed the word from staff to caregivers because again, my concentration, my emphasis now is for you as a caregiver at home, whether you are the spouse or you have a caregiver that is working with you at home. So if our frontline staff, caregiver at home has a negative attitude towards sexuality, whether you as a wife, as a husband, as a daughter, as a son, as a family member, as a caregiver who is hired to be with you, you have that negative attitude towards sexuality because of your education, because of your perspective towards this gentleman or this elder person who is expressing his sexuality. It might be very difficult to be assisting others to maintain a positive attitude towards sexuality. That's why, as he said, education, education, education. We have to continue educating everyone, every member of the family, the daughters, the sons, the caregivers, the dad, the wife as a caregiver, or the husband. If our own nurses, aides, or caregivers, or other caregivers are not comfortable with this topic, they might feel that expression of sexuality by an older person and is wrong or unnecessary or even embarrassing. So this will lead to what? It will lead to abuse towards this person. And we don't want that. We don't want our elderly to be abused because he or she expressed any sexual action towards a caregiver. And as we said, it can be by touch, by cuddling, this is all part of sexual actions. And we don't want any negative perspective from a caregiver towards this elderly person. Next slide, please. So this will cause the dilemma. It is again lack of education, lack of training. The frontline caregiver at home, in a facility, in an institute, if the frontline nurses, aid, activity professionals, social workers, caregivers, etc., report receiving a little or no training in the long-term facility, at home, or in the community on the topic of sexual expression in the elderly. This is the dilemma. What will happen? This means that this place, the home, the facility, or whatever, are leaving it up to the staff to respond. And I don't want it that way. Mark doesn't want it that way. No one wants it that way. We don't want it to leave it to the staff, because one staff can take it as simple and humble as it can be. Another staff can cause an abuse towards that person and can cause of her being dismissed from or terminated her job from the job that she's having if she's a caregiver. And again, if this, Mark, you want to say something?
Yes, I actually do, Maria.
Yes.
When you talk about abuse isn't only in the community or in a facility setting. The abuse can occur at home as well. The family members, because of lack of training or education, or the everybody's own cultural or religious beliefs, may think this behavior or that behavior is taboo, and because of that, they want to prevent their loved one from engaging in any kind of behavior like that. And that's where that can become an abuse. And that's where you're depriving that person of part of an aspect of their life that's important. And so, I love the way you bring this topic to the community, that we can truly help people in helping our elders and helping all of us age well, all aspects of aging, including intimacy and sexuality. Thank you.
And we all have to be united on that. The educated people has to be united with the non-educated, and that's why we need the training for them. We need to work together on bringing this taboo to an open-minded, to an openness. We don't have to keep saying, you know, culturally, this is not acceptable. Religiously, this is not acceptable. I don't have this at home, at my home. It should not happen this at my home. This caregiver did this to my dad because he touched her. The caregiver did this to my dad because he smiled or he asked her to give him a kiss or to give him a hug. We don't want that. It can be as simple as showing them what is the advantage of allowing this person to express his emotions. And this will go to the second slide, please. All right. Let them express sexual expression, and with dementia people, addressing the caregiver concerns. You know, if inappropriate sexual or intimate expression as a result of dementia, we have to make sure that those people, they know that this person is dementic. He's not in his full mind to when he expresses his sexuality. Then touching other people with the sexuality without being able to like discern if the desire is mutual. You know, he does not know. He thinks, sometimes they think that this person in front of him is his wife. Sometimes he thinks that his son, like the mom at home, if her son is the caregiver, he resembles her husband, and this happened in front of me. He looks exactly like her husband when he was his age. She's showing intimacy to her son. Her son did not know what to do because she cannot differentiate that he is not your husband. He looks like your husband. She goes back to that age, that time when she was meeting with her husband at the age of her son now. It's also like inability to verbalize yes or no to others' sexual advances. Like this person that you expressed, one of them expressed the love, the intimacy to another one, unable to say, no, I don't want that. No, stay away from me. They're not able to do that. And also the misinterpretation now. Misinterpretation, I found it's more in caregivers. When they misinterpret the action that comes from this person as a dementic patient, as a dementic client that she has, if he touches her, if he smiles to her, if he hugs her, you know, they all express that he's coming to me to ask for sexual. You know, that's the misinterpretation again, and that's how the caregiver addressing it. So if we start teaching the caregivers that if you see these behaviors, this is how you need to act, this is how you need to respond, whether this caregiver is the daughter, the son, the caregiver from a company, or the wife at home. And the same if the person expressing the feeling is a woman towards a man caregiver. Next slide, please. So what does the behavior mean? You see a resident disrobing. You have to know what the disrobing it means. To me, as a nurse, he might need to take a bath. He's not asking for any sexual. You see a resident undressing another resident. He might trying to help her. He sees that, you know, she's, you know, he might not ask for intimacy. But if you see those action, you know that you have to give the right objective behavior or thinking about this behavior. So it's not always mean that he's asking for sexual intimacy relation. Disrobing is not always, I want to have a relationship. You see two residents holding hands and hugging. What behavior are you gonna, what does that mean? To me, it means that become friend. They're just becoming so close friends. For someone else, they'll say stop because this one is not good. I have a little joke here that happened in front of me. I used to take care of a resident that was with me, and the wife was to come. They're not with me anymore, so, but just the story is nice to say. That's how she misinterpreted the behavior. She came in and she saw her husband holding one of the resident's hand. She immediately dragged her husband from his hand, got him out of the facility, and she said, "You are not staying here a minute. Let's go home." She did not know that, poor man, he is not all there. He does not know what he's doing. He did not mean that he is holding her hand, that he's going to be with her all the time. So she has to take him out, and she took him out and left. So what can you do? This is, again, it's all about education. If we educate our community, our caregivers, whether it's a wife, a daughter, a son, a husband, whoever, that when you see your mom or your dad holding someone's hand, it is not a big deal. They just need they're lonely. They need someone to feel their emotions. So next slide. So residents' interactions with male residents, with female residents, with staff, with family, with visitors, with the body language. Sometimes these are the interactions it follows the previous slide that we just talked. So it is okay for them to be like a male residents interact with another male, with another female, or a female with another female, or with another male. Their interaction with me and you, Mark, you're a caregiver. I am a caregiver with another caregiver. Their body language, they want to hug, they want to kiss, they express it sometimes. Sometimes the body language, it can be fearful. You have to be as a keen observer for your loved one. Their body language talks about fear, it talks about happiness, it talks about agitation, calmness. Facial expression is important. The posture they're taking is important to give you a hint of what's going on behind that one. Waving hands, like sometimes they just wave for you. Sometimes they're not able to talk, so they give you the body expressions and the body language, which we know that communication can be verbally and non-verbally. Verbalizing, they can say, "I don't want this man to come next to me. I don't want this caregiver." Too many times they will say, "I don't like that. I don't want that." So that means that they have a bad experience with this person. They don't want them to be around them. Sometimes they show anger, they show fear, they show friendly, and sometimes you will see them shouting. Out of nowhere, they're just shouting. They don't want to be next to someone. Sometimes it's acceptance, sometimes it's refusal. So based on the cognition, based on the medical condition, based on the environment that you are in, whether at home, in an institute, you need to be, as a caregiver, know how to explain that behavior, because that behavior can trigger something that you don't want to deal with later on.
That's fantastic, Maria. I learn every time, every time that I go through this presentation with you, and every time we spend time together talking about this topic, I learn so much from you. You can go to the next slide, Pam. Thank you.
Thank you.
Thank you, Maria. So here are some topics to help you train your staff on becoming more aware about intimacy. Help them understand domestic violence and how that plays into our seniors' lives. Help them understand the homosexuality issue, the bisexuality, transgender issue, because that issue wasn't always prevalent when our seniors were first coming out, and many of them live closeted lives because it was taboo at their time to be homosexual, to be a lesbian, to be transgender. So under the staff, and when we say the staff, the caregiver, whether it's a family member, as Maria said, or a professional staff providing care in an environment of a care environment, it's important to train the staff and train the family members to understand these issues and how they relate to intimacy. Sexual assault, as Maria spoke of earlier, a person may have been sexually assaulted 30 or 40 years ago, and especially if they have dementia, they may be living in that moment And so when a caregiver goes to provide that direct care, they're brought right back to that moment of sexual terror. And so as caregivers, they have to be trained to understand how to work with that person in that situation. They have to understand working with folks with dementia and how that relates to intimacy and sexuality. And all caregivers, family and professional, need to understand empathy, compassion, and tolerance. Have an open mind. There's never a time that's too late. Let's make sure it's the right place and the right time, and let's make sure we train everybody. Also, there's ethical considerations and boundaries in making legal decisions and decisions regarding a resident's rights, specifically as it relates to human sexuality and intimacy and so on. So it's important that we as family members, that we as professional caregivers understand some of these issues moving forward, and we seek more training and more education and understanding of these issues. The next slide. Go ahead, Maria.
It's also, please, let's go back to the previous slide just for one second here. If you notice, there is an ATC there at the end. I am begging everyone listening to this presentation. These are not only the topics that you need to be trained or we need to do training about. ATC means that if you are listening to this topic that we are presenting now, and you feel like you as families at home or caregivers or professionals, you add to this training that we put here more subjects, please add it to us. Please add comments. I know it's not the end of our presentation, but since we are on this slide, add any comments that you want us to add it to our presentation for the future. This presentation has been done twice already, 3 times. And each time we do it, people will say, do this, add this. I am asking you to add it for us in a comment, or even give it to Pam as she introduced us, the lady introduced us at the beginning of this presentation, so we can modify, add, and even put more examples there in front of you. Next slide, please. Inappropriate comments and attitudes to never have or say. So if you notice here, inappropriate interventions or attitude from me as a professional, from Mark as a professional, from a caregiver who is at work working with one of these dementic people that they are expressing sexuality. Never judge them, please. Never assume. As I said, disrobing. Don't assume that he is disrobing because he want to have a sexual intercourse or coming to do something with you as a caregiver. Holler, punish, or
reprimand.
I'm sorry.
Reprimand.
Yes, thank you.
That's
or
okay.
Don't even humiliate this person. This is no need for that. There is no need for that. Don't go and jump to a conclusion. We don't need that. On the other hand, you don't have to say, you're not supposed to be here. Why do I need to tell him that? He's dementic. You know, he's demented. He does not know what's going on. He is just wandering in your home, in his own home, or in his own room. You're not supposed to be doing that. What are you doing here? You're not supposed to tell him that. That is disgusting. Let's say that you saw him disrobing, or you saw him even masturbating. That is no, that's not disgusting. You don't say this to him. Please try to be more supportive for them. Try to be more helping for them. They're already out of their brain. They're already frustrated. They already don't know what to do. They need someone to listen and be there for them. They need a friend. So please don't humiliate them, and don't say anything that even trigger them, because guess what? You are going to get the blame afterwards. Whatever action comes from them, you're gonna get it, because you're the first person in front of them. You tell him you're disgusting, this is not right. You tell him you're too old to do that, you cannot say that. You should know better. No, don't say that, because they
You
don't know
know,
better. Yeah.
Maria, I'm sorry to jump in. One of the things you taught me a long time ago was what you call positive redirection. So instead of saying, Mr. Jones, you're not supposed to be in here, you give Mr. Jones two positive choices and positively redirect him another place if that's not where he's supposed to be. But don't make him feel bad about it, because he may not be in the mind to understand. And I love when you taught me about that positive redirection. That's great. Pam, if you can go to the next.
Here you go. This is the positive redirection. Intervention. What are you going to do for an inappropriate behavior in public or the common area? Where is the common area? In his home. He's sitting in his living room and he was watching TV, and maybe a scene on that TV, it was some kind of kissing or hugging or intimacy. You know, with those soap operas, they're always kissing. And he immediately start pulling his pants down and start masturbating in front of you. You don't go jump and say, hey, but what are you doing? You're disgusting. You get out of here. And you started using your awful language with him. Don't. You as a mom or a dad or a daughter or a son, please, instead of that, remove him from the scene. Get him out of that living room and say, come on, dad, why don't you go to the to your room? It's better if you stay in your bed. Why don't you go to your bed? He will love it. And that's from my own experience, guys. It happened in front of me. And all what I did is, would you like to go to your room? Oh, yes, please. Can you take me? Take him to his room. Assist him to go to his room. Pull the privacy curtains. Put the curtains down. Make the room nice, more romantic for him. Let him finish his job, her job, and you are safe and he is safe. Maintain dignity. Please respect them. No teasing, no shaming. There is no need for all of those issues. Try to help him. Give him his comfort zone or her comfort zone, because this will keep you away from having him agitated, combative, aggressive towards you. You are going to be blamed. As I said, you blame yourself if you do something that makes him mad while he is trying to have his intimacy time. Next slide. Suggested intervention. We just said the main, like it was in a public area, and now it's a different suggestion here for intervention. You can, especially like a specialty clothing, you can put on him. That's what I did. Like I'm talking about what I did in my own. You can like do like a robe, open robe, so he doesn't have to worry about taking his pants down and all of this, or hair closed down. It's an open one. You can utilize distraction instead of, you know, when you catch it in the middle of it, you cannot do any distraction, by the way. There is no they have to finish what they started. But if you know, like what happened with me, and I know the minute he or she started doing the action, you immediately take them to their room, do what you have to do, it's okay. But to do it and say, let's go do it and let me give him a snack now, it is too late. Too late to give a snack. They will not even listen to you because they're not there to listen to you. Then you can also eliminate the triggers here. Which is the trigger? What are we talking about here is the TV. Your TV is the trigger. You put a different show other than what he's watching all the time. He's sitting in front of that TV watching the same show every day that is full of kissing and hugging and all of that. Get it out of his way.
Right. Put on Fox News. It definitely won't. Nothing sexually suggestive on that program.
You can also, instead of that, put like what I suggested, and it's helping a lot. Put some songs and start singing with them. Some of them are religious, by the way. Put some hymns and start singing with them. Dance with them. Say, hey, let's go dance. And you start dancing with them and you're done with it. So these are suggested interventions that you can use on the long run. Next.
Thank you.
All right. Consent.
So consent is determining, we have to understand consent. And what is consent? Consent is permission. It's approval. It's agreement. It's acceptance. It's voluntary. Okay? And it has to come from understanding, and it's not forced. So consent is between the two adults, but they have to have an understanding of the situation, and the caregivers around have to understand the situation. And the guidelines are, number one, the person understands the distinctively sexual nature of the conduct, and the acts have a special status as sexual. So intercourse might be, for example, intercourse, both partners have to be willing to participate in that and give consent in the ways that they're able. That the person understands that their body is private and they have a right to refuse. So a person can never force themselves on another person, be it to residents, be it even spouses.
That's right.
If one spouse says no, or one partner says no, it's no. And the other should never force the situation. That the person understands that there may be risks associated. We spoke earlier about protecting yourselves from sexually transmitted issues and so on. So both parties have to understand and give consent that there may need to be some protections involved. And that the person understands that there may be a negative societal response. Again, people always judge, but it has to be appropriate, in the right place at the right time, and the persons engaging in this activity have to give consent, both members. Maria, did you want to add to that?
It's also the person that you are trying to get the consent might be in a medical or physical condition that is not fit to be with you at that time. So like a person with COPD, with emphysema, they're not able to do any of that. And you go towards them and start asking for any intimacy, they cannot do it. Even if they want to do it, they have the desire to do it, they cannot do it. So you have to, as you said, Mark, consent, permission, approval, agreement, acceptance. Accept the person in front of you. And that's between the couple. The caregiver is the important one here. We're going to keep talking about the caregiver is the important, because if the caregiver is not in a physical condition to accept what this dementic person needs from her, that will be that can consider APS intervention here. I have one of the APS cases that come to me because the wife is not able to take care of her dementic husband, who is actually physically, sexually very active, and he is on Viagra. She called APS and she said, please, I need help. She did not say that until we met with her in person. She was so scared of him. So we need to educate those caregivers that you have resources to reach to about what's going on if you cannot take care of your spouse. And mostly it happened that the caregiver usually is the wife and the husband is the one who has the dementia and who's active, sexually active. So that's where, we have to have the guidelines and teach the caregiver the guidelines. This is mostly for caregiver as at-home caregiver. We're talking about the spouse as a caregiver. Next slide, please. Adding to consent. No one person can make the decision for another person to have an intimate relationship. This is exactly what I just said about the lady that she called the APS. He thinks that she can do it. He's been doing it with her, she can do it. But physically now she's older, she's developed arthritis, she developed COPD, she is on oxygen all the time, she cannot. So he assumed that, he got the approval, we're okay, she's my wife, I can do it. Not family, not legal guardian, not an agent can add to that consent. They're not able, they cannot give you the consent to go ahead and do it. Intimacy is too personal. It's between you and whoever you are with, and you have the relationship equally, mutually agree on it. Every person must be capable of deciding this for themselves. So it's a yes. So no one can say yes for the other. Everyone has to be mutually agreeing on it. Next slide, please.
Next slide.
Common questions and answers. These are for the audience now that they're listening to this. We just put 3 questions. Mark and I work on 3 questions that we are giving it to you, and the response is how it can be. But if you have more questions, we are happy to add to these questions and also to give you the answers to the best of our knowledge about it. Question number 1, I'll say question number 1 with the response, and then if Mark wants to go on, we can do it together. So the question is, what is the best strategy to address sexuality with the resident and or the family? We're talking about strategy here. The response, facilities should have policies and procedures in place and be sure to open the dialogue from the beginning about what those policies are so that it is less uncomfortable and emotional if when a situation arises. Strategy. Let's say that this also not only in a facility, by the way, it's the same question arise at home. When a caregiver is at your home and something happened from a spouse to his caregiver, you know, the elderly person is at home, start having any sexual action, whether it's a touch or undressed, you know, all those behaviors we're talking about. We should have policies and procedure as an institute, as a facility, teaching our caregiver, if this happen, don't assume, don't judge, don't humiliate, don't say this, but you do the following. One of the things that we always say to our caregivers is try to put boundaries here, you know, try to say, stop right there, you know, Mr. So-and-so, Mr. You notice what I said? Mr. So he's not anymore Jimmy or Bobby. He is Mr. now. When he hear the Mr., it means that I am making it as a formal now. We're not friends anymore. Okay? So that's a question. And the strategies, it can go on and on and on, but we have to set it up and start educating about it. That's one of the questions. Second.
Well, here's a couple of other questions. Number 2, don't older adults lose their sex drive and urge as they age? And this is a myth. Every person has a different sex drive and a different urge, and it doesn't mean that it goes away as they get older. For some women, once they go through menopause, their sex drive increases. For some men, you know, once they you know, feel a certain way, their sex drive increases or decreases. It's a myth. So understanding each person, it's an individual preference, and that you understand each person as an individual and address with them the issues and understand with them the issues that may come up as they express their intimacy and their sexuality. And the third question is also dear to my heart because I have members of my family that are in the LGBTQ community. And so the question is, how can I identify an LGBTQ friendly long-term care setting for myself or for my loved one? And here's a response, and this is a general response. And again, it all is a matter of individual preference, but here's some general responses to that. Key things to look for are, does the facility allow same-sex and or non-married couples to live together? Do they provide their staff training on LGBTQ issues, which may be different than some of the other issues that we've talked about? Do they help place transgender or older adults with roommates? Does the facility display LGBTQ symbols or literature, or include welcoming signs for that LGBTQ community in their materials and their brochures? So these are some of the common questions as it relates to intimacy and aging. Please, if you have a question now, raise your hand, or Pam can, or you can type it into the chat box. Is that correct? If you do have a question, we'd be happy to answer it. And next slide, I think that was the last slide.
That will be it, the last one.
Yeah.
But I wanna talk about the the previous slide, please. And then we go to that. Yes, the LGBTQ, it used to be the gen silent. Most of the LGBTQ are afraid even to say something about themselves in the past. That's another taboo here. They were afraid to say that we need a nursing home. We need caregivers to come at home and help us. We need to be placed in a retirement facility, because they were not sure if they are going to be welcome in that facility, welcome in that community. And that's why we call it the gen silent. And now it's more open, no more taboo about it. And you will see that, as Mark said, you will see that facilities are start opening their doors for them and caring for them. And to be honest, when you are a patient, you are a patient. When you are a resident need help, you are a resident need help. Whether you are at home, in a facility, in a hospital, in a retirement community, you need help, you get the help. There is nothing to be afraid of. You are going to get the help no matter who you are, because I'm talking about myself as a nurse. I swore to provide the help, to be an advocate for all patients who needs help, and I will continue doing that no matter what, no matter who is in front of me. Help has to be given, and I will advocate for you the way I advocate for anyone else under my care. Same with Mark. I know that for sure. So with that and the questions that we have, we go to the end of our slides.